Hi, this is Dr. Brenda Nordstrom, and we're going to be talking today about human trafficking, trauma, and long-term health. Many of you are nurses, so I threw this one in here. When people experience toxic stress, environmental exposures to, bad things that are going on, environmentally, whether it's lead in your water or viruses and things like you think of um, people who live in areas where the poverty is so bad that they struggle to get water and clean food and things like that. Maybe there's malnutrition. Basically, over time, these things end up with a cumulative burden. On top of that, you have a biological embedding of this toxic stress, and um, the trauma actually gets into the genetic level of what's going on inside our body. It then causes a physiological, as it says here, a disruption, a change. So now on that genetic level, and it starts to those weaknesses start to intensify because of that cumulative burden of toxic stress and trauma. It causes problems in our neurodevelopment. It affects our immune system, our metabolic system, the endocrine system, the cardiovascular. I mean, it affects us on the DNA level. It actually starts to break down the bonds within our DNA. So it makes us um, so that we are, it makes us predispositioned for illnesses, and it causes disease. And these disease combined with the mental health aspect of health behaviors, drinking, drugs, sex, those types of things that expose us to other health threatening problems can actually lead to early death. We're going to touch on it in a minute. It's called an ACE study, Adverse Childhood Experiences. And they have found that people who experience 6 out of the 10 identified experiences can actually decrease life expectancy by up to 20 years. So these are the 10. 3 fall under abuse, 2 under neglect, and then there are 5 that fall under household dysfunction. Now, if you think about those who are trafficked, many of them have experienced a high number of these ACEs, adverse childhood experiences, prior to being trafficked. So their body has already been set up mentally, if not physically, for future victimization. Then if you look at what's referred to as the paravases, so you have those adverse childhood experiences, you throw in an adverse community environment. So you live in a neighborhood of extreme poverty, there's violence, there's gangs, there's, poor housing, you don't, can't keep warm in the winter and you're freezing in the winter. Uh, all of those things together then create an environment that makes people vulnerable to things like human trafficking, but they also affect us on that neurobiological level, right, like I said, right down to our DNA. When it comes to our brain, what happens there, and this is very simplistic, but what happens in our brain is that you get increased circulation, increased activity in the limbic system, which is where your emotions are. And I don't know if you've heard the term, but neurons that fire together are wired together. So when you have trauma, it causes certain neurons to fire together and to create basically a superhighway going on inside the emotion center. So our emotion center is on high activity. Unfortunately, though, the logic, the decision making, the prefrontal cortex, the hippocampus, where your memories are stored, that part of the brain actually slows down and doesn't work as well because everything's going on inside that emotion center. All of the activity, that part's going to light up, whereas the other is going to suffer. So now imagine you have a teenager who has been traumatized. Their limbic system is such where their emotion is on high alert. They're in that fight, flight, or freeze all the time. Um, high anxiety, high fear. So they're driven by emotions and they have poor ability to think logically and make decisions. Okay, these are the people who then go on to become victimized in our society here in the US. So some of the effects of trauma, um, trouble with coping, I mean, even normal stress just sends them through the roof. As you have read about, being able to form that trust bond with people, having healthy relationships is because they don't know any different. That part of their brain was not developed. They've been in fight, flight, or freeze, for as long as they can remember. Uh, and again, memory problems, attention, logic, all of those things that help with going to school. So then you have trouble with your education, have trouble with, getting that good job, maintaining a job, getting through school. And you throw in, you know, hyperarousal and difficulty regulating emotions. Well, people don't want to hire, you know, workers who can't manage their emotions, that fly off at the drop of a hat when somebody, um, they have a perceived insult, or they get extremely upset crying. Um, Now, some people, most go to the hyperarousal. There are a few that will go to numbing or maybe even avoidance. And you can see hyperarousal, except for when certain triggers happen, then all of a sudden all of this, they'll just jump right down and they'll become numb or they'll shut down. You can see the walls go up, and that's their protective measure. So if it gets too close to the heart of their issue, then boom, they'll shut down. And that's a protective measure. That's how they try to keep themselves sane. Now, for children, for obvious reasons, as you can see, the more adverse experiences they experience, the more likely they are to repeat grades in school. They have trouble with maintaining those grades that are needed because they can't remember, they can't regulate their emotions. That whole resiliency with getting up, when you get knocked down, getting back up again, that suffers. And some studies indicate that 70% of children with ADHD also suffer from a high number of ACEs, as well as those emotional, mental or behavioral conditions. Think of defiance disorders, depression, anxiety, those types of things. Now, ACEs and adults, if you have somebody who is now an adult, think parent, and they have 6 or more ACEs in their history, they suffer increased levels of stress. Um, so they're compared to somebody with 0 to 5 ACEs, 11 times greater level of stress. Then you have ACEs plus stress, you get distress. So now we have a bunch of, we have people who are highly distressed in life in general, let alone when they face bills are due, they're shutting off my electricity, I don't know how I'm going to feed my kids, those sorts of things. And of course, this seems to be higher in the female population. Now, the greater the number of ACEs that the adult suffered in their childhood, the greater their level of distress. And that is because they end up with a low threshold, um, a low stress threshold. And this persists throughout life and also increases the risk of those stress related diseases and disorders. Now, just so you can kind of see with adverse childhood experiences, there have been a ton of studies on this. Doctors Anda and Folletti are the original researchers, and they did the original landmark study in 1998. If you're interested in this, shoot me an email and I will send you the study. But even on the CDC site, they will have a ton of information on adverse childhood experiences. But as you can see, as soon as somebody has 4 or more ACEs, they are a huge risk for everything from cancer to IV drug use and attempted suicide. Um, so it is really huge, and that we understand when working with others that the mental health and the physical health are in a very precarious balance. Um, and the mental affects the physical affects the mental, and in the end, it causes a lot of health related issues. So what does this mean when we're responding to somebody who might be a human trafficking victim or is a survivor? They've just come from being trafficked. Now, this one's specifically for the nurses in the group. Some of the common behaviors that you will see um, in the clinical setting, especially in ER, OB, is you're going to see um, the kind of patient that drives everybody crazy and nobody wants to take care of. We get very empathetic when we hear the stories about everything that they have suffered and they've gone through. And when I do trainings, I tell people to hold on to that feeling, because as soon as you get a trafficked person, especially a domestic sex trafficked person in your care, uh, they're going to give you a run for your money. I mean, we're talking potentially uncooperative and hostile, very manipulative, um, very dramatic. And to them, they don't see themselves as victims. They're in a situation, they may identify some bad choices that they made, because there's lots of reasons that they could have gotten into their trafficking situation. The fact that they stay with the person, I love that person. And, we've talked a little bit in the discussion aboard about why it's difficult for someone to leave their trafficking situation. They look at their trafficker as a boyfriend. It's their family. Sometimes they have kids back at the house. And so trying to get someone to leave their trafficking situation, understand that, maybe they have a friend or a child back there and they don't want to risk their health and safety. But understand they're probably going to try to manipulate you, and that is part of their survival technique. They use these behaviors on the street in order to stay safe, and they don't shut these behaviors off just because they come to the hospital for treatment. So just don't take it personally. One of the things that I say, try to remember, is that it's about what happened to them, not what's wrong with them. And that helps kind of shift, and also understanding that their behaviors are part of that trauma background, and it helps you to remove yourself personally. So realize you're not being attacked on a personal level. It has to do with a whole lot more than you, which is why we want to use a trauma-informed approach. We want to make sure that we're non-judgmental, um, keeping the patient at the center of all that we do. And I'm sure you've heard me say more than once, it's about empowerment. We need to empower them to make good choices and to, be able to take care of themselves and to get out of their situation. And I'll talk more about trauma-informed approach in another video. That was, I mean, I'm already going way over. I'm at a half hour, so I apologize. But when we are working with somebody that has trauma, how do you find out if they had trauma? I personally like option number one, is just assume that everybody has a history of trauma. Now, if you are pretty sure that somebody does, you can screen for the impacts, the the emotional, mental health issues, addictions. You can pretty much assume anybody that has an addiction has a trauma of some sort in their past. Health issues, diabetes, cardiovascular, those types of things go along with trauma. If you must ask, use open-ended questions and do it in a discussion in a very non-judgmental way. And that can help get a conversation going. But definitely you want to leave option 4 up to a professional who has had a lot of training on how to do that. So as I said, option 1, assume a history of trauma for all of your patients, or if you're not a nurse, if you're interacting with somebody in a service, if you provide services of some sort, just assume everybody you work with has trauma, and always use that trauma-informed approach. There is a tool, and in this week's workshop, you have a choice of 3 tools, I think, to look at, and this is one of them that you can look further into. But the PAIR tool works for all types of trauma, not just human trafficking, but it is highly recommended for trafficking situations. Basically, provide privacy. That means get them away from a kind of controlling person, whether it be the male or the female that's with them that doesn't want to leave their side. You want to educate them, but you want to do it in a non-judgmental way, in a way that normalizes the sharing of information, such as you say to them, I educate all of my patients about domestic violence or about intimate partner violence, because violence is so common in our society, and violence has a big impact on our health, our safety, our well-being. I have a brochure here on it. There is a card here with a number. Feel free to call this number, but sometimes this happens, and please, let me know. And you just kind of start educating. And, when you get to the ask part, those brochures that you just handed them, why don't you just take this with you, even if you're not having problems with violence? Maybe you have a friend that has an issue, or somebody else you just know. So why don't you just take this with you and give it to that friend? Let them know that you care and that you're thinking about them. Now, of course, if they choose not to take the materials, understand that it could be because of their safety, so respect their decision not to take it. Allow time to discuss. Is there anything you'd like to share with me? Do you feel like anyone is hurting you, hurting your health? And of course, screening for that intimate partner violence is something that goes on in a lot of places now, just because that is so common. You can also say, I've noticed that, you have some bruises, or I noticed that you're extremely stressed out. You've got a lot going on. You've just lost your job. You're struggling whatever, insert the blank. I've noticed, and I'm concerned for your health and your safety. If you don't want to share details with me, that's absolutely fine. You don't have to tell me anything, but I can connect you with resources. Would you like to speak with, and then offer them an advocate or a service provider? If you don't want to speak with them now, that's fine, but you can just let me know at any time and I will get you hooked up. But only limit those questions to those needed to determine a patient's safety and to be able to connect them to resources, a trained advocate. You then want to go on with whatever medical reason that they're there for. If you're a nurse, or whatever service you're providing, um, you don't want to pry. So the goal is to not find out all the details. You just want to find out enough to connect them to the people that are available to help them. If the patient denies that they're being victimized or they decline assistance, definitely respect their wishes. If you have concerns about safety or, offer them information on resources, they may or may not take it. And again, respect their wishes. Um, if they do decide they want us to be connected with a resource, do what's called a warm handoff, which means that you actually take them and introduce them to the person. And if it has to be done on the phone, make sure you have a nice private setting for the phone call. And if it works out that it's better for, like, the person on the other end of the phone, say, hey, Rita, this is Brenda. I'm over at the hospital. I'm working with somebody who wants to get connected with the Hope Project. Here is Jane. I want to introduce you to Jane, and then hand Jane the phone. So that kind of warm handoff. But anyway, and of course, you've got those national hotlines that you memorized at the beginning of this course. If after your assessment you determine that somebody has experienced trauma, it's important to get them the resources that are appropriate for the type of trauma that they have suffered. If someone is being trafficked, you truly believe that they are being trafficked, then there are a couple of things that you need to keep in mind. First, you want to assess safety and health needs, which of course means seeing that patient alone if possible. Studies and personal experiences indicate that the trafficker themselves usually is not much of a safety issue within a medical care facility because they don't want to get caught. They don't want to go to jail. So if anything, if it seems like they are going to be in trouble, they will end up leaving. They may try to intimidate, and if that occurs, you just keep the security on standby. Try not to engage if possible. Just be uh, strong in your stance and very confident and tell them, you know what, this is policy. This is just the way it is. I need to see the patient alone. I need to get a urine sample. I need to go get an x-ray, and our policy is you can't come with. That sort of thing, just to get them away. But anyway, attend to their health needs. And if you are able to talk to the patient, according to the PAIR tool, you want to educate them about human trafficking. If they are not ready to identify themselves as someone who is being trafficked, then you don't want to force them to identify that way. Psychologically, that can be very damaging. You want to find out what their goals and their priorities are. If they realize they are in a bad place, they've suffered abuse, they're malnourished, they've got injuries, that sort of thing, and they're ready to leave the situation, then great. Treat whatever injuries or health needs they have, but in the background, start working on getting them resources and help them get out. If though they want or they don't want to leave, they don't agree that they are in a bad place, they're going to be very adamant, I have to go back. They know their situation better than you do. Either psychologically they're not ready to leave, I'm talking an adult here, or they may have a child back at the home that the trafficker has in their care. They may have a friend or a family member, or they realize that if they leave, somebody else is going to be harmed. There may be death threats against their family members, things like that. So they know more than you what is best for them in their particular situation. So please don't judge them harshly if they choose to go back with their trafficker. All you can do is educate and give them the number, the human trafficking hotline number, 888-3737, 888, and try to get them to memorize that. If they need to take it with them, it has to be done very discreetly, because if they have anything on their person that indicates that healthcare workers have identified them as a trafficked person, they could be in grave danger. So I had one survivor tell me that, just put the number on a scratch of paper and they can stick it in their bra, because then it's easy to hide when they're taking their bras on and off. A lot of people used to tell them to stick them in their shoe. She said that for her, she didn't see that working so well. So again, you just got to kind of work with the situation that you have, but develop a relationship with them. Let them know that if they are ever to a point where they are ready to leave, that's a number that they can call. Um, I work with an organization that has been contacted by the human trafficking hotline, and the designated person has gone out and met people who have called this number, picked them up, and helped them get to safety. I think one or two were even sent back to their home country per their choice, to get back with family members. So that number is a good one to call, because they will respond wherever they are in the U.S. If though they need to have, let's say they've got an STI, and you think they're being trafficked. Well, if you don't give them the antibiotics, or give them medications that they may need, and tell them, I'm sorry, you're going to have to come back later when the cultures come back, that's not going to work for them, because they're probably not going to come back. They're going to have to find another caregiver that's going to give them the antibiotics that they need, or whatever their need is. So be sure to treat their health issue, develop a relationship with them, and let them know that if they do need to come back, they should come back, and you will do whatever's necessary, or somebody will, to get them the help that they need. Document your suspicions and your findings. You do it very forensically, just like you would any abuse situation, and know that there are ICD-10 codes for human trafficking, both confirmed, suspected, and history of. If somebody is under the age of 18, you are required to notify CPS, and then CPS will notify law enforcement, whatever your facility's procedure is for that. But if they are over 18, you need their permission before you can call law enforcement. So don't just automatically call and, oh my gosh, I got a traffic person, I have to call the police. No, if they're over 18, there are situations in the ED, such as, knife wounds, if somebody's been strangled or severely abused. There are certain policies, depending on where you live, that you have to call law enforcement when they have these specific injuries, and let them know that up front, that that's what's going to happen. But don't just call and say, hey, I have a traffic person here and I need somebody to come and help them. A lot of police officers aren't trained appropriately. You're better off sometimes calling a organization in your area that works with trafficked persons. If nothing else, domestic violence shelters, places like that, that can give them the support they need, the psychological counseling, and then when they are psychologically ready, then they may go to law enforcement. That gets very, very complex. That's a whole nother presentation there. But anyway, 888-3737, 888. And here are a few other national resources. So if you have situations where you want to know more, or questions, you can call these numbers. All right, so that's the end of this presentation, and just I say we need to treat everybody. If they fall down, if they're in a bad situation, whatever it is, offer that hand. If they are an adult, they get to choose whether or not to take that hand. But all we can do as nurses, healthcare workers, is to be there to support them and to provide them with whatever services and resources that they need. All right, thank you so much for listening to this. And if you have any questions, please contact me. Thank you so much.